Welcome to another episode of Unicate Talks, a podcast for Unicate College. Today, we will explore how emerging science connects to real-world challenges in health, food, and society. Today's episode looks at a piece of UK-funded research that asks a deceptively simple but powerful question. Could sound waves one day help slow brain aging? This episode has been developed with the consultation of Dr. Watkis, a chartered scientist, whose insight supports the scientific framing and accuracy of today's discussion. To understand why this research matters, we need to begin with the wider context. Across the UK and globally, populations are aging. People are living longer than ever before, which represents one of the greatest achievements of modern medicine and public health. However, increased longevity also brings new challenges, particularly in relation to brain health. Age-related cognitive decline and neurodegenerative conditions such as dementia now represent a major public health concern. Their impact extends far beyond those diagnosed, affecting families, carers, healthcare systems, and wider society. They also carry profound emotional, social, and economic consequences. Most existing approaches focus on managing symptoms after damage to the brain has already occurred. While some treatments may slow progression, they rarely restore lost function. This has led scientists to rethink not just how brain aging is treated, but when intervention should occur. Rather than asking how to repair damage late in life, researchers are increasingly exploring how the brain might be protected earlier, maintaining function and resilience for longer. This is the scientific space in which the research featured today sits. The work explores whether focused sound waves, known as ultrasound, could influence the brain's own immune cells, called microglia. Microglia act as the brain's internal maintenance system. They remove waste, clear damaged proteins, and help support healthy communication between neurons. In younger brains, microglia are highly active and responsive. As the brain ages, these cells can become less efficient. When this happens, harmful proteins and cellular debris may accumulate, increasing vulnerability to cognitive decline and neurodegenerative disease. The research explores whether carefully controlled sound waves can gently stimulate these aging microglia. The sound waves create subtle mechanical effects at the cellular level, encouraging calcium to enter the cells. Calcium acts as a biological signal that can help reactivate microglial activity. In simple terms, the research is asking whether it may be possible to prompt the brain's own maintenance system to behave more like it did earlier in life. It is important to be clear about what this research is and what it is not. This work is still at an early stage. It has been explored primarily in laboratory and animal model settings. It is not a treatment currently available to patients, and it is not presented as a cure for dementia or other neurodegenerative conditions. Its significance lies in its contribution to understanding. Scientifically, this research expands how we think about brain health. It shows that physical forces, such as sound waves, can interact with biological systems in meaningful ways. It broadens neuroscience beyond pharmaceuticals, highlighting how mechanical and physical interventions might influence cellular behavior. It also contributes to a growing shift toward non-invasive approaches. Focused ultrasound does not involve surgery or systemic medication. If developed further, it could complement existing treatments rather than replace them. From a public health perspective, the implications are considerable. Even modest delays in brain aging across a population could have substantial effects. Fewer years lived with severe cognitive impairment would reduce pressure on healthcare systems, extend independent living, and improve quality of life for millions of people. This research also reinforces a key principle in health science. Timing matters. Supporting biological systems earlier may be far more effective than attempting to repair them after significant damage has occurred. This principle applies not only to brain health, but across preventive medicine. There is also an important educational and societal dimension. This work illustrates how interdisciplinary modern science has become. It sits at the intersection of neuroscience, physics, engineering, immunology, and aging biology. Understanding it requires systems thinking rather than isolated knowledge. It also shows how scientific progress unfolds gradually. Innovations begin with questions, move through controlled experimentation, and are refined over many years. Learning to recognize these stages helps build scientific literacy and realistic expectations. The research further highlights the value of early career scientists. Doctoral and postdoctoral researchers often drive exploratory work, testing ideas that may shape future directions even if they do not immediately translate into clinical applications. Public investment in this type of research is therefore an investment in long-term capacity. Even when a specific technique does not reach widespread use, the knowledge gained informs future innovation. At a global level, the relevance extends beyond the UK. Aging populations are a shared challenge across many countries. Research exploring scalable, low-risk approaches to maintaining brain health has international significance. This work also invites reflection on ethics, regulation, and access. Technologies that interact with the brain, even non-invasively, raise important questions about safety, oversight, and responsible use. Early understanding allows these conversations to happen before technologies become widespread. What makes this research particularly powerful is that it challenges how we traditionally think about aging itself. Cognitive decline has often been treated as an inevitable outcome of growing older. While lifestyle factors are known to be protective, biological aging has frequently been viewed as something that can only be managed once symptoms appear. Research like this questions that assumption. It suggests that aging may involve active biological systems gradually losing efficiency, rather than a simple, unavoidable decline. If those systems can be supported or re-engaged, aging becomes something that may be modified rather than simply endured. This has profound implications for how societies plan for the future. If brain aging can be slowed even slightly at a population level, the cumulative impact could be transformative. It would reduce long-term care needs, support independence, and preserve dignity and identity later in life. There is also an ethical responsibility to communicate this science carefully. Explaining emerging research clearly helps avoid hype while still recognizing genuine promise. It builds public trust and allows learners to understand both the potential and the limitations of new technologies. For students and professionals, this research provides a valuable case study. It shows how innovation develops, how uncertainty is managed, and how evidence gradually informs policy and practice. Perhaps most importantly, it reinforces a broader message about health across the lifespan. Brain health is shaped over decades by education, nutrition, physical activity, sleep, social engagement, and environmental factors. Technologies like focused ultrasound, if they continue to develop, would sit within this wider framework rather than replace it. They remind us that prevention is rarely about a single solution. It is about layered strategies that together support resilience and well-being. In that sense, the research explored today is not just about sound waves and brain cells. It is about how societies respond to aging, how science prepares for future challenges, and how knowledge is built responsibly over time. Thank you for listening to Unicate Talks. Today's episode has explored an emerging area of neuroscience alongside its wider scientific, public health, and societal significance. And a special thank you to Dr. Watkis for his expert insight and guidance in shaping today's discussion. Until next time, stay thoughtful, stay informed, and stay curious about the science shaping our future.